Okay, well, good afternoon. I hope that everyone will be able to hear me, and for all the speakers, just remember to mic yourself and mic yourself off. Welcome to Headway, a new roadmap in mental health. I'm Mariam Zaid, and I'll be hosting today's event, which is organised by the think tank, the European House of Ambrosetti, in partnership with Angelini Pharma and Euractiv as media partner. And to everyone who is physically here in the room with us, thank you for participating, and also to our online audience, thank you for joining us and, of course, for registering for this event. Now, if you do want to get involved, don't forget to put in your questions or your comments along with your name and the name of the speaker your comment or question is directed to, and we will keep picking out your questions for later on in the programme. And also, this is a conversation that we're going to have today about mental health. So if you are someone who is suffering or has suffered from any sort of mental health problems or crises, this is a safe space for you to tell us your stories and to put in your questions or comments. And we thank you, of course, for sharing your stories with us today. So mental health. I think it's safe to say that it is still, for many of us and for society at large, a taboo subject. We are yet, as a society, to perhaps properly understand mental health problems and to have perhaps real understanding for it. But here are some sobering facts. 110 million people live with mental health issues. It's in the top 10 of the most common diseases in the continent, and the second biggest non-communicable disease affecting people in Europe. So that means so many people are perhaps living with it and they just don't want to talk about it, or they don't want to tell people about it. So let's now also add in another factor. It's something that perhaps we all perhaps want to forget a little bit about, that horrible nightmare that was the pandemic. The psychological impacts of the grief that we've all collectively gone through, money problems, loneliness. I mean, I can just think of, myself, or think about yourselves, the way in which we all had to live essentially very isolated. The bad health some of us might have suffered because of contracting one of the many strains of the COVID-19. All of this has had a massive impact on our mental health. A lot of people also say that it's had a massive impact on two very specific generations. The older generations, for example, we could think about the people that lived in care homes. They were very isolated. And then also the younger generations, the people that were supposed to be going to school, having physical classes, meeting their friends. I mean, if you think about the ways in which we as children or as young people, enjoyed our education, the way in which younger people have done that during the pandemic really wasn't something that I think any of us would want to have lived through. And the legacy of this pandemic is really going to continue to impact our community for years to come. That neatly takes us into what Headway is. Headway was launched in 2017 by the think tank, the European House Ambrosetti, in partnership with Angelini Pharma. It is a multidisciplinary platform for strategic reflection, analysis, diagnosis, and comparison between various European experiences. And by European experiences, we mean not just about the individual experiences that people have gone through, the experiences also of the experts in this field, and their sharing of their knowledge as well. Now, this year, the goal of Headway is to continue the work that has, of course, been started since 2017. That is, sharing that knowledge and know-how to prevent, in the first case, but also diagnose, manage, and find solutions that contribute to reducing the burden of mental health disorders, whether that is for the individual or for the society at large. Now today, during this event, you're going to see the results of the updated Headway Mental Health Index 2.0, which is essentially going to give us all a snapshot of, you could say, the mental health picture across the EU27 and the UK. Now, what today is hopefully going to be is an opportunity to have a frank discussion on mental health, and also to drive the conversation forward, we could say, in EU capitals, and perhaps also think about a European way forward. Now, in Brussels, in this bubble, a lot of the time we do talk about a European way forward. Essentially, what we're talking about here is a roadmap on mental health. And hopefully the experts, who you can all see seated around me, they're going to really put the flesh on the bones of how countries can adapt or readapt their mental health care systems to help people in need. Now, we were going to have a keynote speech, or opening address, I should say, by MEP Brando Benifei, who is, of course, hosting this event. Now, he's running a little bit late. So what we're going to do, first of all, is look at a very important factor when we talk about mental health, which is our environment. So if we all think about it for a minute, factors such as negative factors, I should say, things like poverty, unemployment, poor working conditions, bad education, a bad family environment. There are so many things that can impact our mental health. If we think about ourselves, our children, our parents, our friends, our colleagues, is their environment healthy? Is their mental health perhaps at risk from these factors? Or even in some circumstances, you know, you may be enjoying, you know, a secure living environment, but there might be just one thing that throws you off and affects your mental health. So that neatly brings us to then our first speaker, Daniela Bianco. She's partner and head of the healthcare area of the European House of Ambrosetti, who will, of course, provide some insights on Headway and highlight the key findings from the Headway Report 2022 and, of course, this year's Mental Health Index. Please do take the floor.
Thank you, Mariam. Good afternoon, and thank you to Honourable Benifei for hosting us in this room at the European Parliament. But I would like also to thank Angelini Pharma, part of Angelini Industries, for having created with us 5 years ago this initiative. 5 years ago, mental health was not so common in the events. So in this year, for the pandemic, for the COVID-19 pandemic, it's a more discussed topic. And so we are very, very proud and very glad for this initiative. When we were in Brussels 1 year ago for the last edition of Headway initiative, the context was very different because we discussed about the effects, the impacts of the COVID-19 pandemic and on the healthcare system, on the economy. And we were in a positive context because GDP was increasing, there were more resources for healthcare investment in Europe. Now we are in a different, totally changed context because, you know, the situation is very complicated, geopolitical context. It's very difficult because of the European conflict for the Ukraine war. If you can see the first slide, please. And so the war, the energy crisis, the increase of inflation, and the uncertainty, we can say, in the index we have included in our report. In addition, the climate change and the impacts on health and on mental health are altogether risk factors for our stability, for our health, and in particular for mental health. And this is the focus we have included in our report this year. As Mariam told, we have added also the environmental dimension in our index that you can find in the report Headway. You can download the report on the website. This new cluster that we have called environmental determinants of mental health, in addition to mental health status and the responsiveness of the system to mental health needs, it's composed of 3 other pillars. One is the natural environment, the built environment, and also the socioeconomic and political context, including migration, conflicts that are very, very important for a mental health in Europe, a good mental health in Europe. So the index aims to be a useful tool, flexible, dynamic, comprehensive for institutions, for healthcare, for governments, to think, to assess, to monitor the status of mental health, but also to design and to, we can say, also to address the European policies. This is the summary of the index that is composed of 55 key performance indicators you can find in the report. Just to have a quick picture, you see, of course, if you cross the different dimensions, the responsiveness of the system to healthcare needs with the responsiveness in workplace, schools, and society, you can see that we have two different clusters. A cluster of the northern European countries on the top right, and the other European countries, especially the Eastern European countries, in the low part of the matrix. The color of the bubble shows the environmental determinants. So it can be useful for governments and for European unions to understand what are the priorities to act in the next year, to act together in a coordinated and comprehensive strategy and approach. I want to thank also my colleague Elisa, Irene, Ilaria, Manige, and Stefania that worked in these months on this report, and our advisor, Professor Celso Arango and Professor Fabrizio Starace, that will present in detail the result of the index. Thank you.
The microphone. Oh, it's back on. Thank you. Okay, thank you so much, Daniela Bianco, for updating us on what the Mental Health Index is. Well, we have our host, our MEP, Mr. Beneface, here, so I'll give him the floor to talk to all of you. There you go. And we are sharing a microphone as well, so don't mind.
Yes, thank you. Thank you for this opportunity to have you here. I'm really pleased to be able to host you here for the organization of this event, thanks to European House, Ambrosetti, and all the other partners. You will listen further to the details after my short considerations. Unfortunately, this is a day of many discussions in the Parliament preparing for next plenary, so I cannot stay for the whole time, but the results of this debate, where we have our offices and we have the attention also of people that I see in the room that work on these topics for a long time all together, also with me and other colleagues, will for sure bring a concrete result for the advancement of our commitment on the topic of mental health in this institution and in general in the public context. So thanks for this work. I want to say that it's clear from also what was explained earlier that we have different key determinants about determining the impact on mental health, which means physical and natural environment, living and working conditions, education, as well as the capacity of the system to respond to this kind of healthcare need that is intertwined often with other healthcare needs. Common mental disorders such as depression and anxiety, moreover, are often linked to social and economic insecurity, scarceness of employment, and poor housing conditions. Personally, I've been very much involved on the impact of these kind of situations on the on young people, especially in the context of the usage of European programs. Think of the European Youth Guarantee, which has been a very important instrument of inclusion of young people that we promoted in these years. That confronted, in fact, with young people that were inactive for a long time, unable to continue a path of education, training, or employment, and then got into a context of mental health disorders, of problems of this kind. And so the incapability of addressing work and social necessities of young people has been linked to problems of mental health. This became evident in this kind of work that we have been doing here in these years. But then after what happened in the recent times with the pandemic, the impact on children and young people in general, we have seen an increasing attention on the topic by the public.
Sorry, Mr. Benefei.
Yes.
My apologies. I'm going to steal the mic off you. I know that you're sort of... but we have one of our panelists, Professor Chelsea Arango, Director of the Institute of Psychiatry and Mental Health, who does need to leave for the airport. So you'd like to speak now. Please go.
Okay, but I can conclude very quickly. I can be very brief. Because I also have to go, as I said, so I will be very brief. The attention that has increased on the topic that we have seen due to what happened needs to be channeled in a proper discussion at the level of the institutions and the stakeholders that are also here. Because the risk is that there is a debate, public debate, which is important, but not an effect on the policies. So I think it's important that we have this kind of report presented here. The EU mental health strategy that needs to be focused and on which the Parliament has been working. Some actions are already implemented. I need to remember them. The Coalition for Mental Health and Well-being, established in 2012, the Joint Action on Mental Health and Well-being report of 2017, the EU Compass for Action and Mental Health and Well-being from 2015 to 2018, and now the European Framework for Action on Mental Health that will endure until 2025. It could be good to consider, as there is this attention, there is this interest also in the public opinion, and this is positive, that we not only push the member states to take more integrated approaches and actions, but also that the next year, 2023, could be a European year of mental well-being. I think it could be a good choice, considering the challenges that we have been seeing emerging on this field due to the very complicated period that we have been living in. Thank you very much again for being here, and thanks for the elements that you will bring in support of our work for a better mental health for everyone. Thank you.
Thank you so much, MEP Benefei. And perhaps we can ask you a little bit later about whether, of course...
No, I can't, sorry.
You can't, you have to go as well. Okay, we're losing our panelists. Okay, so next to Professor Chelsea Arango, please go ahead and take the floor. Thank you so much.
How do I get this
You just press the button.
here?
I'll do it for you, 1 second.
I think you need to probably competing against
I think it is.
Now, yeah. So thank you very much, Mariam. And let's move now to two of the main pillars of this report, which are the environmental determinants of mental health and the mental health status of the population. And I think the first one, as we have already heard, it's extremely relevant nowadays, and I'm very glad that this is a new topic for this report that was not in previous reports from Headway, because as we will see, there are a lot of indicators of potential risk factors or resilience factors that are measured within this pillar that are not I'm not very optimistic in what is going on at the European level. And then we will review very briefly the mental health status of the population in Europe. So when we talk about environmental determinants, what do we talk about? Well, we talk about climate change, we talk about extreme weather conditions, we talk about urban variables, the way we build cities, overcrowding, how many people live in houses. We talk about economical recession, and we also talk about conflicts, migration, and crime and violence. And again, I think that it's a little bit scary of how some of these variables are changing in the recent times in Europe. So let's take a look at this one, climate change, and for instance, temperature increase with 2 degrees warmer surface temperature in Europe. We know that climate change and extreme weather events and warming displacements are related to trauma, anxiety, affective disorders. And this is something we should take into consideration because we see more and more these extreme weather events in our countries. And actually, there is economic loss at the EU due to extreme weather events of 12 billion euros per year in all European countries. And we heard about pediatric population and how they have been affected more than any other age range by the pandemic. And it is the case also that they are also more affected by these extreme weather events than any other segment of the population. Natural disasters like earthquakes or volcano eruptions, as we had very recently in the Canary Islands, also affect the mental health of people with increased suicide risk, PTSD, depression and anxiety disorders, and substance use disorders. And again, we see more and more of these natural disasters with time in Europe. Another urban variables are poor housing and overcrowding. Something that you will notice when you look at the report is that although we're here in Brussels at the European Parliament, there is a huge heterogeneity among countries. And some of these variables are like 4-fold, 5-fold higher in one country as compared to the others. So there's no unity in the prioritization that mental health receives in each one of the EU country. And that's something you can clearly see here with the population living in poor housing conditions or the overcrowding rate and how this affects mental health. There's an alarming factor is that people with mental health disorder are 1.5 times more likely to live in poor housing condition. This does not imply causality, but at least this correlation, which is probably bidirectional, is something that we should be looking into. Pollution in many different levels, noise pollution, air pollution. A lot of Europeans are exposed, and again, children, to these types of pollutions. 1 in 5 EU citizens live in areas where noise levels are considered harmful to mental health. And of course, this has an impact in mental health, especially with anxiety disorders. The Fragile State Index, which is composed of conflict, migration, and economic recession, and I don't need to go into each one of these 3 variables, so it's very easy to understand that the 3 of them are at increase in Europe, also have an impact on the mental health of EU citizens and people who live in areas where they fear they're going to be a crime or violence, are more likely to have depression, anxiety, and they spend less time in social activities and gatherings. The second part is the mental health status of the population in the different European countries. So we look at the prevalence, disability, mortality, and risk factors. And again, you can see the prevalence for the different, or the main mental disorders in different European countries. It's very important to say that some of these conditions like anxiety or major depression have increased by 25 to 27% after the pandemic. So that means that we have now in the world 129 million new cases of depression and anxiety. And that what used to be 1 in 6 is probably more 1 in 5 Europeans are affected by a mental health disorder. Different conditions will have a different impact in terms of years lived with disability. Of course, less severe conditions that are more prevalent, like depression or anxiety, will have higher impact, and you can see that also in this slide. My probably humble and biased impression is that mental health issues do not receive the relevance and importance that they deserve. And probably one of the reasons is that politicians think that these conditions are not killing people. And where the money needs to go is to conditions, medical conditions that really kill people. Well, we have to remind ourselves that people living with severe mental conditions like schizophrenia or bipolar disorder live between 15 and 20 years less than the general population. And that approximately 4% of all cases of death in Europe are caused by mental and behavioral disorders. One of the problems that is causing higher mortality is suicide. And again, suicide rates are very different from one country to the other, but we should pay attention to the increase in suicidality, especially suicidality that we're seeing in very young people. And when I say young people, I mean adolescents and children after the pandemic. There are many other risk factors, including alcohol abuse, smoking, and drug use. I'm really ashamed and embarrassed to share with you that still more than 20% of Europeans still above the age of 15 still smoking, huge rates of alcohol abuse, and huge use, especially among young people, of illegal drugs, including cannabis and other drugs that cause serious mental problems. So I will finish with some personal reflections, and we know now, and we know well, and it has been replicated many times, that there are a number of risk and resilience factors that are amenable to change. And I think there is no excuse anymore not to try to reduce risk factors and increase resilience factors. So I think it is time now for a public mental health approach, because mental disorders are clearly a public health problem in Europe. Many of these programs and initiatives are not only effective, but they are cost effective, so they will save public money to each one of the EU countries. So we have to put primary, not secondary, tertiary, but primary prevention at the forefront. As I mentioned, there are new factors that we have not addressed sufficiently in the past, including natural climate change, urban environment, and political and socio-economic variables. And finally, following the WHO advance, we need to deepen the value and commitment we give to mental health. Thank you very much.
Thank you, Professor Chelsea Arango. Before you go, because I know you do have to run away, you were talking there about the sort of factors in our environment that can obviously affect people's mental health, and you were comparing across the 27 member states. You also said something very interesting, that politicians don't necessarily put their resources on mental health because it isn't something that can be cured. They'd rather focus on curable diseases. But is there perhaps one member state where you've seen a reversal of that because of the pandemic?
Yes, indeed, and I'm very glad that I have Hilkka Karkainen here with me, because she's not only representing a Gambian here, but she's from Finland. And we saw that cluster of Nordic countries, led by Finland, that, by the way, is the only one that has 3 greens in this report among all European countries. So I think that Finland and Nordic countries, especially because of the way they put into education and mental health in the curricula in the primary schools, and that's a very good example that we should all follow.
Thank you so much. Okay, now please, thank you so much for being a part, of course, of this discussion today, and I hope you make your plane. Thank you so much. Okay, time now to look at the responsiveness of healthcare, welfare and educational systems, as Professor Arango was talking about there. I invite Fabrizio Starace, who is the president of the Italian Society of Psychiatric Epidemiology, to take the floor. Please go ahead.
Thank you very much. And let me start by underlining again the importance of having an instrument as the one we are discussing today, picking up the different aspects of mental health, those related to the prevalence of psychiatric disorders, to environmental drivers increasing the risk of mental health problems. But now we'll see also the other aspects related to the responsiveness of the healthcare system, not only in the health sector, but also in the workplace, in schools, and in society at large. If I can have the first slide. We'll see now that there are two main aspects we have analyzed in healthcare and in other pillars. This is very important to my opinion, because if you do not consider mental health problems with an intersectoral approach, since mental health is present in different aspects of our life, for the principle of communicating vessels, we'll find it somewhere else. In other terms, for instance, we'll see in a minute, if we have not enough investments in mental health, in the health sectors, inevitably we'll find more people in charge of the social sectors for mental health related problems. So what apparently seems a save of money is not so. Let's go ahead with the next slide. I can do it. This is just a quick picture of some of the key indicators we used, but we may go in more details looking at the characteristics of the health systems in terms of healthcare professionals. As you may see, there are significant differences among the European countries, and also in terms of healthcare infrastructures. There are many differences. We should consider this extreme variety, trying to support countries, different countries, in filling these gaps. But let's come to the economic burden. The OECD has estimated that the cost of mental health disorders in Europe is on average 4% of the global domestic product. On the right side of the slide, you may look at what are the investments each state dedicates to mental health as a proportion of the health funding. If you translate these numbers in proportion of the gross domestic product, you'll see an incredible difference in a distance between the costs and the investment. Let's take the example of Italy that I know very well. The costs are estimated to be 3.3 more or less, but in terms of investment, Italy has 0.2 of the global domestic product. This is another contradiction we have to deal with. These are a number of indicators looking at the responsiveness to mental health problems in workplace, society, and schools. Look at the difference, the intolerable inequalities in employment rates of people with or without mental distress or disorders in European countries. And look on the right side at the difference in terms of gap between average gross wage of workers with or without mental health conditions. This is another example of inequality that has to be overcome. Staying again in the field of workplace, look at the paid sick leave and the unemployment benefits for mental health disorders. This is an example of what I was telling you just a few minutes ago. If you don't invest in creating workplaces that take care of psychological and psychiatric disorders, you pay on the other side in terms of more days of sick leave and so on. And you'll find in these two slides. These slides show you the disability benefits paid for mental health disorders in European countries. And on the other side, the percentage of people with poor perception of social support. Here, maybe later on, if we have time, we can go in more details, because the perception is not only function of the empirical number related to disability benefits, but also on the expectancies that could be higher in several countries and lower in others. But this is a summary of what is done today in terms of responsiveness, in terms of programs for mental health promotion and prevention, suicide prevention programs, mental health awareness, parental mental health promotion, disaster preparedness. You can look at how many cells need to become green in the, I hope, not too distant future. Let's go very quickly to the responsiveness to mental health disorders in schools. Here you can look at the summary. You see that 80% of mental health disorders we know starts before 18. There is a higher likelihood of dropping out of school for these students. And they are 24% more likely to have repeated a grade. Look at the share of school dropouts of students with a mental health disorders. This is, of course, a function of the capacity of inclusiveness of schools and the school system in each country. And here again, you will see a schema, a summary schema, looking at the presence of programs for mental health promotion and prevention in children and adolescents in school. Those related to early child development, those reporting school-based programs. We have heard of these, the importance of these programs as an example in the experience of Finland. Again, we see many cells that need to become green. I stop here, but I don't want to stop my presentation without underlining again that we have a very powerful instrument collecting the several aspects in which mental health can be dealt with. I am very optimistic about the progresses we can do, bearing in mind that mental health is not only a clinical problem, but has to do with many aspects of our life. Thank you very much.
Okay, thank you so much, Mr. Sirace. I actually wanted to pick up on something that you said there. 80% of mental health disorders present themselves before the age of 18. That's a really scary piece of data.
You shouldn't be scared by the reality. You have to do with the reality in a more efficient and effective way. For instance, overcoming the distinction between a child and adolescent psychiatry and adult psychiatry, which is something that very often is an obstacle to an effective carrying out of programs starting in adolescence and going ahead in adult life. So this is also an option for mental health system to upgrade, to modify, to reorganize in function of the problems we know are in a different way as compared to what we thought 50 years ago.
One last question, since you're talking about upgrading there. We spoke yesterday, when we're talking about investments and supporting member states and filling in the gaps that they might have, when we spoke yesterday, you said that Italy was closing down or has closed down mental health institutions. So it's taken a different approach. And I wanted to ask you, why did it do that? And is that new approach not only responsive, but is it working?
Why we did it is because we applied principles that are overarching the area of mental health. And these principles are related to the area of human rights. Large institutions for mental health, but for elderly people, for disabled children, are very often not respecting their human rights. So on this basis, we went ahead along a reorganization idea that put the core of mental health activities in the community, because we are aware that mental health problems are in the communities, are related with the characteristics of those communities. With, as we have seen looking at the environmental problems, we know that if we are working with each patient but knowing what is surrounding him or her, we can do our work more effectively.
Thank you. And I think that's a really important point you made there about making people feel like they are human beings. Okay, let's move on then. And we are going to talk about, sadly, the COVID-19 pandemic. Now, as we know, the COVID-19 pandemic created essentially a pandemic within a pandemic. So many people suffered, and they continue to suffer, debilitating issues related to their health, but also their mental wellness has been affected. A question, is a policy response the solution to help those who have, of course, been forgotten by the pandemic? Let's give the floor to Lara Flesher, a policy analyst from the Centre on Wellbeing, Inclusion, Sustainability and Equal Opportunity at the OECD. Please do take the floor.
Great. Thank you so much for inviting me. And it's a pleasure to be here. Congrats to the Headway team on releasing and updating this work. It's really great to see how, really stressing mental health, not only in the healthcare system, but in workplaces, schools, society at large, and now adding in this new environmental aspect is really, really important too. I think it's really clear that we need truly integrated policy approaches if we want to create environments that people can thrive in. So I work at the OECD in a team that looks at what we call well-being approaches as one tool to further such integrated policy making. And I'm going to show you a little bit how that looks like for mental health. I don't know if my slides are on. I just can't see them, sorry.
Don't worry, I think, oh, it's saying, hang on a second.
Okay, no worries. Perfect. Wonderful, great. That's great. So we've heard it a couple of times already. The pandemic and the rise in mental distress across the population has made very clear that everyone has mental health. And in fact, by 2021, almost a third of the population across OECD countries was reporting symptoms of depression or anxiety, especially for depression where we have pre-pandemic data that has nearly doubled compared to beforehand. What we also know, however, is that not everyone has been equally affected. So gender gaps in depression have widened. We've already heard about young people being affected more than others. And in fact, there we have newer data from early this year, early 2022, and we see the mental health of young people has slightly recovered, but remains highly elevated compared to what we saw before the pandemic. And in the countries where we do have data, migrants and people from racial and ethnic minorities have also been affected worse in terms of mental health. And if we see what else happened to these groups during the pandemic, it's very clear that other areas of their lives, so what we call their unique well-being risk and resilience factors, have also been disproportionately affected. So young people, for example, their mental health has definitely suffered against the backdrop of school and university closures, labor market shocks. You can see here on the left slide, left hand, that younger people experienced much higher rises in unemployment compared to their older peers during the pandemic. When it comes to loneliness, everyone has felt lonely during the pandemic. In fact, by early 2021, 1 in 5 people across the EU said they felt lonely most or all of the time. But again, young people, the unemployed, and those living alone were almost twice as likely to feel lonely during that time. For women, we know they've picked up the major share of unpaid work, including childcare during the pandemic. And we know that, again, for the countries where we have data, people belonging to racial and ethnic minorities were much more affected in terms of COVID-19 mortality rates, unemployment, and financial difficulties. So it's definitely clear that our broader life circumstances matter for our mental health. And on this slide, you can see this is pre-pandemic data, which also shows you that all of this already mattered before the pandemic. You see a range of well-being deprivations. Those range from having difficulty making ends meet, being dissatisfied with one's job, being unemployed, but also being exposed to pollution in one's area, to crime, being dissatisfied with how we spend our time or personal relationships, having no trust in the political system or no trust in others. And we see that systematically, people with psychological distress, that's the dark blue bar, fare worse in every single dimension of well-being compared to those without distress and the total population average. So a project we're working on at the OECD at the moment is applying this holistic multidimensional well-being lens to mental health, trying to answer 2 questions. One is really about those well-being risk and resilience factors that have been mentioned by so many speakers today already. So what are the interlinkages between mental health and people's experiences, be they economic, social, environmental, or relational, and what can we learn from that when it comes to designing individual policy interventions? And then the second question is taking that up one level up to the more systemic level. So what are countries already doing in really mainstreaming this across sectors? Are there already integrated approaches that are working, and what can we learn from that? So the conceptual lens we are always using is the OECD Wellbeing Framework. You've seen those icons in a couple of other slides before. They are also very similar to how Headway is thinking about the environmental determinants of mental health. But for us, those are kind of the key ingredients of what it means to live a good life. So all the dimensions that really matter to people themselves. And for time reasons, I'm not going to show you how each of those dimensions relates to mental health individually. The one example I like to actually use is environmental quality and climate change and mental health, but I know we'll have other speakers on that here. So I'm instead going to show you another dimension, civic engagements, or how we relate to institutions, because I think that's really, really important, and that's not always top of mind when we think about people's mental health. So on this slide, we see this is, again, European data, European social survey. We see the difference between people experiencing depression and people not experiencing depression in different types of political behavior. So voter turnout, political motivation, or having the feeling of political agency, and participation in actual political acts, which can be, going for protests. And we see for all European countries, there's a large and marked gap between people experiencing depression and those that don't. And the kind of pathways that have been hypothesized here in the literature include, a lack of motivation and actual physical capacity to participate in politics due to somatic problems, fatigue, and feelings of hopelessness. But I will say, again, it's always a mutual relationship in both directions as well. So politics can also affect our mental health. And in fact, there's increased data that suggests that people are increasingly feeling anxious about our societies being, increasingly polarized. So the relationship can definitely also go the other way around. So what would be examples of policy interventions that are win-win, that could improve both civic engagement and mental health outcomes? So one would be to improve the participation and representations of those with lived experience of mental ill health in politics. That can be through, targeted campaigns, facilitating voting more generally, but also voting of institutionalized populations, decreasing the stigma of political leaders that admit that they've had experience of mental health issues, to also encourage a more diverse group of people to run for office. When it comes to clinical practice, political stress and political uncertainty can be integrated there. And on a broader scale, it's really important to create civic spaces to bridge political divides that we're all feeling. And for that, we do need, funding for community spaces such as libraries and more public spaces to begin with. This was just one example of one well-being dimension. This is my last slide. I just wanted to say a few words about the second question we're trying to answer, which is the more systemic level. What are countries actually already doing in terms of integrated approaches? And again, here I'm talking about OECD countries, many of whom are European countries. And we've identified kind of 4 ways that they are pushing ahead with integrated well-being and mental health approaches. One is to realign and really push forward a whole-of-government approach that can be via dedicated cross-department budgeting structures, cross-sectoral target setting to really facilitate health in all policies, or creating new institutional structures that really bring oversight or bring together all agencies whose work impacts mental health. So one example here would be New Zealand, who have recently started an independent mental health and well-being commission that has oversight in that specific topic across all other public agencies. Second one, redesigning, is taking into account the well-being, risk and resilience factors when we are designing policies, especially so by agencies that are not traditionally associated with mental health. One example here comes from the UK, where the Treasury, so Department of Finance, has launched the Breathing Space scheme, which combines debt relief with access to mental health treatment. Refocusing means an emphasis not only on reducing suffering, but also on positive mental health. So how can we create conditions for people to thrive? And a couple of countries, including Australia and Canada, have launched dedicated positive mental health strategies here as well. And it seems like there's no big difference, but there is a change in framing here that is really important. And lastly, it's important to reconnect not only across public sector, but integration also means connecting with people with lived experience and non-governmental actors such as the private sector. And here I would like to talk about the example of Accelerate Estonia, which is a startup accelerator backed by the government, where they've put the challenge of solving population mental health to a broader range of entrepreneurs that can submit proposals. I thought that was really interesting. I'm going to end here. If you're interested in work, you can find more information here. And congrats again to the team.
Okay. Thank you so much, Lara Flesher. And thank you also for highlighting one good thing that the UK is doing, pairing debt relief with mental health wellness. Okay, and since Lara, of course, was talking about the pandemic, one of the things that she, of course, did highlight, we want to now focus on the link between mental health and big global events like the pandemic, like, of course, this massive thing called climate change. So I'm going to give the floor now to Elaine Flores from the London School of Hygiene and Tropical Medicine and Stanford Centre for Innovation in Global Health, who joins us via video conference from London. Please take the floor.
Thank you so much, and good afternoon, everyone. So I am really happy that I am going to continue with what the previous presenters have already stressed, which is I will be presenting a bit more into the interplay that environment and climatic exposures and impacts have on mental health. I don't know if you're able to see my slides. Okay, excellent. Thank you. Next one, please. So this will be basically the outline of the topics that I want to present. First, I would like just to say that, well, climate change is absolutely an emerging priority on a global scale. We have like a vast majority of countries that recognize that climate change is actually happening and that we need to respond, but also that there is substantial evidence emerging, although it's still scarce compared to other areas, other health areas, on the evidence of the impact of climate change on mental health. So what I want to highlight are mostly about the interconnections across the different key components and the role. Next one, please. So before moving on to climatic events and response strategies, I would like to emphasize that within the concepts of human security and human rights and good governance, the environment is very much a recognized key component of health, mental health, and well-being of populations, including disability, mostly with a holistic point of view. So there will be also an emphasis on the freedom that future generations have to inherit a healthy natural environment. So it is absolutely imperative for us to ensure that we don't contribute more to all the negative impacts already happening of climate change, and that we all do as what we can to minimize the impact so that we can actually have a natural environment to continue living in. So as we already know, and it has already stressed by previous panelists, mental health and many common mental disorders are shaped to a great extent by the social, economic, and physical environments in which people live. So social inequalities will be associated with increased risks of many common mental disorders. And as you can see in this graphic, the social determinants are very much connected to all of these in one way or another. And we can see how climate change and its implications absolutely require this type of thinking around the social determinants. Also, that we need to stress that disadvantaged communities and populations are feeling the harshest consequences, which also include people living in the European region, but also in low and middle income countries. Next one, please. So, as we already know, mental disorders have been historically invisibilized in both the research and funding agendas, despite its importance. In the European region, we know there are leading causes of disabilities. It's the third leading cause of the overall burden of disease. And by 2015, their estimated prevalence was equivalent to 12% of the entire population at any one time, without considering any other problems as substance abuse or neurological disorders, which would bring up to a prevalence of 50%. So globally, these disorders are continually growing across all age groups and are also extremely costly at both the individual, community, and societal levels. So globally, the treatment gap are also is really huge, much worse in low and middle income countries, but they will also have like a current and recurrent course despite treatment and rank across the most substantial causes of death worldwide. Next one, please. So we can see this is a really complex scenario. This review from 2021 looks at all the different components and the processes and mechanisms of the different impacts of climate change and how they are associated with mental health and well-being. So we need to keep in mind that there will be direct and indirect impacts with short-term or long-term factors interacting to impact mental health and well-being. So most of the time we will have in mind acute events such as disasters that they can act through mechanisms similar to traumatic stress, leading to, as we all know, well understood psychopathological patterns. But in addition, there are other consequences of exposure to both prolonged weather-related events, but they can also be delayed, encompassing disorders such as chronic post-traumatic stress or even transmitted to later generations. So just a few examples that have already been mentioned. We have extreme heat events with an increased ambient humidity that we have evidence that is associated with increased mood and behavioral disorders. Other disasters such as floods, storms, and hurricanes related to increased depression and anxiety and other common mental disorders, and also the increased risk of developing or worsening PTSD, as well as suicide and suicidal ideation. Next one, please. So with the current climate emergency that we have, we need to remind us that all these interrelated and multiple environmental disaster events are happening at the same time. So we need also to keep in mind that some of us will be much better equipped than others to weather this type of storms. And in the European region, there are population groups living with higher vulnerabilities and heightened exposure to these environmental hazards. That may differ in each setting, and most of them are rooted in structural challenges. So also there is a growing interface between climate-induced mobilities as adaptive responses to climate stress. And I also want to keep in mind that, well, the Human Cost of Disasters report highlights how extreme environmental events are now dominating the disaster landscape in our century. In the past years, 84% of all recorded disasters were related to climate issues. Floods and storms were the most prevalent events, and these disasters are becoming, well, even more devastating and related to the climate emergency. The next one, please. So as we know, well, environmental threats and disasters will be challenging the person's ability to adapt, posing additional risks for adverse mental health outcomes. And this type of exposures can lead to psychosocial distress and mental disorders, some with a chronic course. I like this causal framework proposed by Helen Berry because we will have these interlinked, directly affecting mental health, inflicting more and worse disasters on human settlements that are causally and reciprocally related to mental health. But also they will endanger the natural and social environments on which people are depending for their livelihoods and well-being. And also, well, this will be felt unequally. So we have some groups already vulnerable to these effects, persons living already with mental disorders, underserved or deprived, and with disabilities, which, as I have mentioned before, and other panelists have stressed as well, we have a huge burden on that. Next one, please. And this additional pathway, it may, I would really like to highlight that this global environmental change and the ecological decline are also increasingly causing strong mental and emotional responses and impacts. These are now being described through the introduction of new terms that extend beyond the direct exposure of environmental and climatic events. So we have populations living in changing territories and exposed to new environmental conditions that will experience a sense of powerlessness. There are now new studies showing that people, especially young adults, that are experiencing feelings of loss, helplessness, and frustration related to coping with climate change effects, which is now referred as eco-anxiety. Empirical studies also show that in relation to ecological problems, people experience troubling feelings of guilt and shame that have been dubbed ecological grief. And also another term, solastalgia, will describe a complex phenomenon of this profound sense of loss of connection and detachment from the known environment that they knew due to land modifications. We know that for some indigenous groups, these hazards have even deeper impacts, leading to profound maladaptive disorders and even depression. Next one, please. And finally, as I don't want to miss this, but it may not be climatically related, we also need to remember that we live in a complex world. And there is new evidence that, bringing additional exposures and their possible consequences will have a different impact, of course, depending on the frequency, quantity, and level of this type of exposures, such as those worker-related or persons working on assigned tasks with more or less protection levels. Next one, please. So this is a complex situation, and I am really happy that this new tool, Headway, and also other people are working actively on how to address best all these climatic emergency, all these environmental effects and determinants to mental health and well-being of the communities. So from the research community, there are some recommendations summarized across the evidence base that we have. Decision-making process to tackle climate change must include the cost of mental health burden, which, as we have discussed previously, is huge and frequently overlooked. More coordinated, intersectoral, and focused research with an aim to be inclusive of key stakeholders' collaborations, people's with lived experience, and those who identified with a scale and that are able to scale up successful evidence-based interventions that address the impact of climate change and ameliorate its negative effect on mental health. And also, of course, recognize that vulnerable groups will require different tailored interventions addressing their needs, because not only they will be experiencing their worst impacts, it's also necessary to address structural inequities, social determinants that should go beyond merely offering clinical treatment. And also awareness and preparedness at public level should be clear and also increased. Policymakers should recognize that promoting individual efforts or self-care for these effects may not be enough, and they will need to be tackled from a holistic and inclusive point of view, as well as to be promoting and engaging collective actions to decrease the powerlessness feelings. Next. This is my last slide. I just want to wrap up highlighting a few messages that I think that we should all be taking home. First, try to remember that we are addressing a very complex scenario, and climate change will be affecting on a variety of direct, indirect, and overarching pathways. Of course, there will be disproportionately effects across people most marginalized, and we have strong evidence on these links. And the issue of mental health and a changing climate needs to be efficiently and holistically addressed. Reckoning with social, environment, and climate injustice is needed if actions to address the environmental determinants of climate change and mental health are to be rooted in health equity. So now we have an opportunity to address this impact for transformative action. Thank you so much.
talking about that transformative action and for talking us through how extreme weather can really affect us. I mean, just think about something called SAD, so seasonal affective disorder. You know, as soon as the weather changes, we all start, it starts really affecting quite a lot of people. So we are now going to go over to our roundtable, but just before we do, I invite Pierluigi Angelini, the CEO of Angelini Pharma, to close this chapter of the event and to give his thoughts on how Angelini Pharma is engaged in mental health and the challenges that you see going forward. Please take the floor.
Thank you. So good evening to everybody, and I'm very happy to be here representing Angelini Pharma. And thank you also for the speakers, because I think I've been learning more by listening to each of you on top of what I've been reading on the report. Now, as you can imagine, by coming before the round table, I'm gonna change totally my speech, because I don't want to repeat what you already heard. What is important, what I noticed by going through the slides, is that actually mental health, as everybody says, should be more on top of government agenda versus what it is. I think progresses have been made, but when I look at the data that you showed individually, I see that those are younger people, right? A lot of significant incidents happens with adolescents, with the incredible impact from a societal and also individual standpoint. And those are people that are going to have a long life and are going to be significantly affected by those diseases: depression, anxiety, schizophrenia, epilepsy. And when I look at the impact, for example, on the societal, when I see that, for example, on average, I read that on average those patients, they have salaries which are about 17% lower than everybody else. They typically work less. They go in early retirement. They work part-time. Or when I see students, for example, that are dropping, 14% of students dropping because of their mental health diseases, that kind of opens my eyes that not only we need to do more from a company standpoint, because we need to put in place specific initiatives in order to address the needs of our collaborators, which is what we are doing within Angelini Pharma for quite some time. But there is also a need for governments to really define which are the policies and how many resources in a world of scarce resources, where it's a bit of a zero-sum game, and you have to decide where to allocate your resources versus, for example, oncological patients or mental health patients, or those are choices that need to be made. And I believe that the reason why we will continue to support this type of initiative, Headway, is that finally we are starting to have clear data, which as a manager I like, right? Because the data allows, as I was discussing with a couple of speakers, to really substantiate what the issue is, what are the implications of those patients, and therefore it's a call of action for governments on a European level, but also individual governments, or what they want to address with which priority. Therefore, you should expect moving forward that Angelini Pharma will continue to work in partnership with Ambrosetti to really, drive and enlarge, like we did also this year, on top of mental health, also start speaking about brain health, including also epilepsy, because I think it makes sense to provide, a continuity in terms of, understanding what are the root causes, what are the outcomes, and also, as I read, understanding which are potential interventions that can be made country by country, because I think there is also an element of not only the quantity. I see certain boxes, right, where specific initiatives that have been implemented in countries, but I think it's important to, and it's not visible, what's the quality? What's the quality of those programs? Because it's a question of efficiency, but also effectiveness of those initiatives. So we'll do everything possible, of course, in providing, making leapfrog, advancing the science and identifying for what pertains to us innovative treatments, but also supporting those initiatives that actually are going to be helping putting mental health on the right priority within the government agenda. And therefore, I applaud and I think we support very much and endorse the petition advanced by some of the MEPs like Benafei, by Dura Ferrandis, Wizir, and Walsh to make 2023 as the year of dedicated to mental health, because I think this is going to be helping all of us to really, putting this issue, this topic at the right level of the agenda and increasing the awareness. Therefore, I will close saying that we'll continue to work in continuity with supporting, therefore, as I said, Headway, but also working with governments and with the WHO, with other bodies in making sure that we can write together and we can contribute as a company in defining what's the roadmap for a new brain health in Europe. Thank you.
Okay, thank you so much, Mr. Angelini, and definitely, partnerships are what is needed. Okay, so our experts have spoken in depth about the contributing factors, but what about the strategy or approach that is needed to tackle this global health crisis? Could policy then help to usher in the right mental health services for the communities or the countries that they serve? And to the big question, should mental health be a European public health priority? Okay, so to our round table then, we have MEP Maria Walsh, we have Margaret Walker from the European Psychiatric Association, we have Hilkka Kakainen, President Gamian Europe, we have John Saunders, Executive Director at EU FEMI, and MEP Estrella Diaz-Fernández. But first of all, we're going to go to a video from MEP Maria Walsh. She is also co-chair of the MEP Mental Health Alliance. She, of course, sends her apologies for not being here in person. And what she advocates for is a more EU-level holistic approach towards mental health. She says that without it, she fears that Europe could end up in a two-tier scenario where only those who can afford access to mental health will actually be able to manage their problems. Take a look.
Good afternoon, everyone. My name is Maria Walsh and I'm an Irish MEP for Midlands North West constituency. I want to first apologise that I cannot attend this event in person and thank the organisers for allowing me to record this short intervention. Mental health does not exist in isolation. Therefore, its management and treatment cannot be considered in isolation. Mental ill health impacts every aspect of a person's life: education, employment, consumption behaviour, access to healthcare and social services. By not approaching mental health as a holistic priority area, we risk creating a two-tier society where those privileged few who are in a position to manage their mental health effectively are able to thrive, and those who are not able to manage their mental health are left behind. And it is only by making mental health a priority in every area of policy making that we can really offer solutions to people's real problems. In the last 2 decades, the world has plummeted into recession twice. Millions of livelihoods have been destroyed, first by the 2008 financial crash and now by the fallout from the COVID-19 pandemic. The problems brought on by the financial crash compounded for many families over the years, creating a really vicious cycle of unemployment, low wages, poverty, which all contribute to poor mental health. And in these cases, just when our social services needed more support and funding to cope with this onslaught of people in desperate need, the money is gone. We cannot keep our citizens trapped in a cycle of surviving from one social crisis to another, with a steady deterioration in their mental health that makes them less able to cope with each and new crisis that we're compounded with. It is a counterproductive social model that leads to greater inequality, sadly lower life expectancy, and a very poor society overall. We need to rethink our current policies if we are going to solve the mental health crisis that the pandemic has triggered. Even more than treatment or preventative healthcare, I should say, we need policies that tackle the root causes of mental ill health: poverty, deprivation, discrimination, unemployment, and lack of educational opportunities. Unfortunately, that list goes on too. In July, us MEPs right here in the Parliament voted overwhelmingly in favour of my file on mental health in the digital world of work. This is the first report dedicated to mental health from the Parliament. And I believe that this report is the beginning of a new journey for mental health here in the European Union. One of the key priorities in this report is developing a comprehensive and proactive EU mental health strategy. This strategy can be developed through intersectional dialogue and cooperation, because mental health, as I shared, affects and is affected by a myriad of internal and external factors spanning all areas of day-to-day life. We are also calling for an EU year dedicated to mental health in 2023 through a dedicated petition. Having a year devoted to taking and talking about good mental health and issues that surround mental health for EU citizens is highly important. This allows us to open up and talk honestly about mental health and push it higher on the EU agenda. Mental ill health presents a major challenge to the well-being of our society and the strength of our economy. While we are making slow progress in policy making that can affect real change on the ground, we have to think laterally across sectors and policy areas to find holistic solutions for Europeans' whole lives. Without mental health, we cannot have a solid health base. Mental health doesn't see borders or a person's skin colour, orientation or gender. It doesn't see where one community starts and one ends. It's our citizens that are at risk if we do not get this right, because mental health is everyone's business, folks. Mental health is everyone's business, remember that. I look forward to hearing from the discussions you all have today, and thank you again for allowing me to share my intervention in my short few words. Enjoy the rest of the day.
Okay, I hope everyone enjoyed what or agreed perhaps with what the MEP Walsh was saying there. She talked about a cycle of survival, and we have been through so many crises of late, and we seem to continue to be doing that. So if any of these things are things that affect you, don't forget to put your questions or comments into the Slido chat page, and we will come to you a little bit later. So we heard there what the MEP Walsh had to say. I want to now ask a question perhaps to Margaret Walker, Hilke Karkainen and John Saunders. You can possibly answer this one for me. How can scientific societies, patient associations and families or caregiver associations contribute to making mental health a European public health priority? Margaret Walker, perhaps you could take the question first, focusing on scientific societies such as the European Psychiatric Association. Go ahead, please.
Thank you very much. Yes, we'll be happy to answer that question. Perhaps I can share some slides first so that everybody can find out, if you don't already know us, what the EPA does and who we are. We're an umbrella organization. We have individual members in 88 countries, and we also have a membership of 44 national psychiatric associations. In total, these represent 78,000 European psychiatrists. We are the main association that represents psychiatry in Europe, and we deal in psychiatric and related disciplines. We focus on the improvement of healthcare for people affected by mental ill health and on the development of professional excellence. We have three main activities. One of them is our Congress, which has been held virtually over the last 3 years, as you can imagine, and we're very much looking forward to meeting in person in Paris in 2023. We also have educational courses that promote lifelong learning, and we also target, with our educational projects, young psychiatrists. So, for example, tomorrow we have our summer school starting in Strasbourg for the first time again in 2 years in person, working with psychiatrists up to the age of 40 who are just, starting their professional career and getting more involved with EPA. And we work at EU level with advocacy and collaborations. We have an office here in Brussels as well as the one in Strasbourg. We have all heard about the numbers. We know the impact that mental ill health is having on Europe. Mental health is being threatened by different social and environmental factors, and these conditions are being exacerbated by the recent events, the COVID-19 pandemic, climate change, international conflicts, and now, of course, we're hearing more about the economic impacts that we're each finding out about in our daily lives, and these also have an impact on mental health. What do we see as the way forward? And I think this is the answer to your question. We're looking to improve collaboration, working with families, with patients and carers, and also encouraging collaboration between psychiatrists and other areas of mental health professionals, for example, psychologists, etc. We're looking for funding for research, but also for speeding up the process of implementation so that patients receive the results of research as quickly as possible. We're looking to stigma reduction. This really impacts people coming to access mental health care, and it's really, really important that we all talk more about the impact of mental health and that we try and reduce the stigma. We look about the harmonization of and development of guidelines across the EU, and we're currently working on some guidelines on schizophrenia. And as I said, we work on engaging with patients and carers. Education is extremely important and part of our work, and we think it needs investment. We also need to invest on mental health care workforce. And we need to prevent. We've seen, and I think one of the speakers mentioned earlier on, that if we target young people, we help them with their mental health, then it's less likely that this will become a chronic condition. And therefore, clearly, it's extremely important. How can we contribute to helping achieve all this? Well, we take part in education and training activities. I've already mentioned our Congress. We have various projects in education that we work on. We act as a platform for exchange with our national psychiatric associations, and this gives us an opportunity not just to let them know of what's happening at EU level, but also to learn from them and to allow them to collaborate and work together. We saw the results of the collaboration, in particular in terms of what's happening in Ukraine, where our MPAs really got together and did an awful lot of work providing training and education to the Ukrainian colleagues. We provide scientific input to congresses. We participate in meetings such as the one today. And we try and maximize the outreach of activities. So, for example, we will be promoting the Headway results and report to our members and our other stakeholders. Mental health clearly for EPA is a priority, and we feel that we need to act together and now. And I think this is something of a stepping stone, all these different areas of work that we're all engaged in, and we look forward to seeing change moving forward. Thank you very much.
Thank you so much, Ms. Walker. Okay, over next to Hilkka Kakainen. What can patient associations do to make mental health a European public health priority? Please go ahead.
Thank you, and good afternoon, everyone. Yeah, so I first start with what is GAMI and Europe. So GAMI and Europe is a patient-driven pan-European organization representing the interests of persons affected by mental health and advocating for their rights. GAMI and Europe represents the interest of more than 60 organizations from Europe and beyond. Our main activities are advocacy and EU policy information, education, awareness raising, and partnerships and capacity building. And our areas of work, mental health patients are the core of our work. We make sure, so this, how you, okay, here, sorry. So we make sure their campaigns and activities reach large audiences and that their voice is heard clear and loud. We work closely with policymakers, European institutions and European level organizations to make sure the needs of mental health patients are added to EU agenda. And through collaboration, partnerships with stakeholders from the private sector, we lead projects in different mental health areas. We strive for the inclusion of patients' views in the development of partnerships and of treatments. And we are a key partner in EU research projects related to mental health. Together with stakeholders from different countries, we look at improving the living conditions of patients with mental ill health. Yeah, okay, so that was already said. EU research, okay, yeah. So, coming Europe's objective for EU-level action on mental health are, well, first of all, a comprehensive EU mental health strategy, and the way as it was requested by the Finnish presidency of 2019 in Employment, Social Policy, Health and Consumer Council conclusions on the economy of well-being. And secondly, a European year for mental health, making mental health everybody's business. That has been the initiative of European Parliament Mental Health Alliance, like Maria Walsh already said. So European Year for Mental Health could pave the way to European mental health strategy and be a good tool in implementing the strategy in all EU countries. So why dedicated EU action on mental health? Mental ill health affects more than 1 in 6 people across the European Union. And as we heard from Celso Arango, this has risen to 1 in 5. And it costs over 600 billion euros, or more than 4% of GDP across the EU member states. It affects persons at any age and in a variety of forms. It has consequences for individuals, families and carers, health and social systems, employees, communities and the economy. Poor mental health is associated with unemployment, social and economic inequality, low income or standard of living, poor physical health, poor quality of life and stigma. And finally, mental health disorders are the fastest growing current health burden. So why EU action on mental health now? Well, as we heard from Brando Banifei in the beginning, the Commission has done different actions already in the past. But now is other things that demand action on this level. There remains much to be done to support the mental health of patients and healthcare professionals in the wake of COVID-19 pandemic. Mental health and physical health are inseparably linked, and with COVID-19 having changed the way we view and access healthcare, it has become a priority for mental health support to be equal to physical health care. And the ongoing war in Ukraine is also highlighting how vulnerable and precious mental health is, and climate change is increasingly creating anxiety about the future of the globe, especially among young people. So why a European year for mental health? Well, there's a need for better and wider understanding of the importance and impact of mental health. We need effective policy and practice in this area. Improving people's well-being, especially during these uncertain times, should be a policy priority and is ultimately saving resources. A European Year for Mental Health could play an important role. It could be a practical and an effective way to raise awareness, provide platform for sharing good practices, and pave the way to mental health strategy. So why an EU strategy on mental health? The strategy will focus all member states on shared challenges and potential solutions. It will drive sustainable actions in the member states and act as a multiplier of knowledge and good practice. And it will involve all relevant stakeholders and will be cross-policy topic. And let us not forget that the Council already called for a comprehensive EU mental health strategy in 2019. So the momentum is there. And as you may have noticed, Commission President Ursula von der Leyen announced an initiative on mental health in this year's State of the Union address. This provides a focus point for advocacy and making our voices heard about what such an initiative should contain and aim for. And the Czech EU presidency conference on 14th November will be a useful opportunity to put mental health firmly on the agenda and discuss a future initiative on mental health. And it will amplify the voice of relevant stakeholders in calling for action. And Gambian Europe will continue to use its blueprint from 2015 for EU action on mental health as an advocacy tool. With mental health now on the Czech presidency agenda as well as on the Commission agenda, Gambian Europe is launching a campaign to involve national parliaments and governments. We work with our members to raise awareness of our blueprint for EU-level action on mental health and work with European Parliament Alliance for Mental Health to prepare the Czech presidency conference. We have the MEP Alliance meeting coming in on October 25th. So you can follow and support the campaign on Gambian.eu. Thank you.
Okay, thank you so much. And thank you also for highlighting the fact that 600 billion euros is the cost of mental health in the EU, and it seems a bit like a drop in the ocean considering the scale or magnitude of the problem. Before we go to our next speaker of our roundtable, I want to say hello and welcome to Pina Picerno, who's the Vice President of the European Parliament. And we know you are going to be talking to us a little bit later, so I'll leave you be. So let me now give the floor to John Saunders. Your thoughts on the push from family and caregivers?
My microphone, yeah, okay. Thank you very much. I've been listening very carefully to what's been said by all the speakers today, and I'm delighted to say that UFAMI is totally in agreement with the sentiments expressed here, the principles and the practices that have been espoused. I don't want to take up valuable time by spending too much talking about the UFAMI itself. We're essentially a non-governmental organisation across Europe, and we support family organisations in national countries across Europe, within the EU and sometimes outside the EU as well. And we obviously have detailed strategic plans around supporting families, and all of that can be found on our website, www.ufami.org. But our essential mission is to support and advocate for family members. In terms of today, I just wanted to contextualize what has been said and how UFAMI fits into it. We fully support the idea of community care, which I think everybody in this room supports, and the move away from old-style services. But for us, community care actually means family care. Many of the people who are living well and recovering in the community are supported by family members. Some are not, that's fine. But those that are, there's a lot of involvement from individuals, usually in a family, who may provide up to 50 hours per week support for somebody to help their recovery. That's not a complaint. That's the way it should be. What we're saying is that we need to recognise that family members are part of this recovery process. More significantly for today's discussion, we believe strongly that mental health is not just a health issue. As has been well said, it's about a multi-sectoral approach involving all aspects of our environment, whether it's weather, climate change, war, disaster, unemployment, poverty, and so on and so forth. They're all very important factors in influencing how someone becomes unwell, and indeed how someone becomes well again. And that's the important thing. The challenge, I think, for us and for national organisations, national governments across Europe, is how you translate that lovely principle into practice on the ground. There are two levels for me. One is the policy. And we would argue that national governments need to create a policy which is multi-sectoral in its approach. In other words, it's not just a Department of Health that provides good health care in mental health care. It must be most, if not all, government departments and other agencies in countries. Laura very clearly illustrated some good examples of where there was non-health organisations providing support for people which helped recovery. There are many other examples across Europe, and I think we need to harmonise these actions across all states. For example, I'll take one that I'm very familiar with from many countries, where departments of justice who support prisons, run prisons, who run police services, who run the court services, can have a huge influence on what happens there. We all know that a significant number of people live in prison with mental health problems. A significant number of people meet the police at night time or weekends and get themselves into trouble, either serious trouble sometimes or sometimes just nuisance behaviour. What is really important is that police forces, for example, have options other than having to arrest and charge someone. In other words, that there are ways that they can divert people into good mental health care if that's what's appropriate for the person in that case. Equally so, we would argue that courts should be open and should have the legislation behind them to allow judges to make decisions when someone is presented in front of them who has clearly or is shown to have a mental health issue. That there's a way that a judge can do something to support that person rather than just asking them or telling them to go to jail. Jail does not help people to recovery, whatever way you look at it. So there are examples like that. There are examples in education, in housing, in other parts of healthcare, in social care. We talked about the Treasury in the United Kingdom, which supports people in terms of financial issues. They're all important ways of dealing with the causes of poor mental health, which are not just biological, but clearly psychological and social and economic. A colleague of mine very well summed it up a while ago by telling me that the real disease in mental health is poverty. It's poverty that actually prevents people from becoming well in many cases, either through homelessness, through crime, through social abuse, through drug addiction, and so on and so forth. For us, the quality of recovery that people make is hugely influenced by family, and national policies and national services need to recognise that family members, in some cases, in my opinion, in most cases, can give a positive contribution to the well-being of their family member. So solutions need to come from government sectors beyond healthcare, and as I said, education, social welfare, housing, environment, enterprise, and justice as some examples. Sometimes in many countries, the support beyond basic mental health care is lacking, and COVID illustrated that very clearly. Because of the necessity of COVID, services shut down. And in many cases, healthcare services shut down, and in some cases, mental health care services shut down, and people were left without the type of support that they required. So you're now seeing, I think, the consequence of that in terms of people who perhaps were doing all right and managing to survive well prior to COVID, were actually then tipped into mental ill health during COVID and are now finding it difficult to re-establish themselves afterwards. So there is that's part of that slang that's used about the tsunami of mental health that's coming, has come post-COVID. For us, again, the focus must be on prevention with people who have mental health problems or who are likely to develop it. We heard about the statistic of 80% of people having mental health problems in adulthood, which may have originated in childhood. I'm not going to dispute that figure, but what it actually points to is the need to have very strong preventative interventions and early interventions during childhood to minimize those risks that might lead to adult and lifelong mental health problems. So for us, in terms of mental health services, there are 4 key issues. They need to be effective. We're very much aware of mental health services that actually don't do what they say they're going to do because they're not resourced well enough or because they don't have the capacity, either financially or otherwise, to do the type of things they want to do. So they are often ineffective. I'm not disputing that the people working in them are trying to do their best. Of course they are. But sometimes they have a really difficult challenge in terms of responding to people's basic needs. Efficiency is really important. We know about the issue of financial resourcing, and politicians, by their nature, don't want to spend money unless they see some result, and that's absolutely fine. What we have to show and illustrate is that if money is well spent in mental health, you can actually promote good recovery, and in time, from an economic perspective, save money. That might be a very difficult way of looking at it because we're talking about human beings and what their lives are. But governments think on economics, and we have to show that there is an economic imperative in investing heavily in mental health care services. Timely is very important for us. We need to have services when people want them. There are countries where there are waiting lists for up to 2 years for services. That's no good to someone who's in deep psychosis. That person will end up in prison because he or she will end up in trouble with the law. People need interventions at the right time, whether it's a child or whether it's an adult. And the fourth one, from our perspective, is localized services, and that goes back to the idea of community care. People are more likely to make good recovery if they get the service they need at the right time in their own place, their own town, their own city, rather than having to travel or not have that service there at all. So delivering to the right person at the right time in the right place for us is very, very important. So I'm going to leave it at that. Happy to talk about it later on, and you can contact us through my own email or through ufami.org. So thank you very much.
Thank you so much, Mrs. Saunders, and for highlighting the important role and the voice of families and caregivers in helping, of course, people that do suffer from mental health issues. Next, in a change to our order of speakers, no reason to say sorry, I invite Vice President Pina Pacherno to take the floor. Please go ahead.
Sorry. Thank you, especially to the organizer of this important event. Mental health is one of the greatest health challenges of our age. And according to WHO data, almost 1 billion people worldwide suffer from a mental health disorder. In 2018, the European Commission reported 84 million people in the European region alone. Some data suggest an even higher incidence, and this was before the pandemic. As we all know, the pandemic had a devastating effect on mental health and on the lives of millions of Europeans, resulting in higher rates of stress, anxiety, and depression. But as we managed to overcome COVID-19, helping our health system and our economy, we should now invest greatly to overcome this silent pandemic as well. While some mental health issues do require hospitalization, we should first of all address mental health in our everyday life, since it is a complex and a cross-sectoral issue that involves us all. As the Headway Index reported, the environment, climate change, but also the wars like the war in Ukraine, has a great impact on the mental health, and we have to work with a cross-sectoral approach focusing on specific and more vulnerable people. We know, for example, that women are at greater risk of mental health issues than men. This is just another consequence of the pre-existing gender inequalities, creating a vicious cycle which we should finally break. This is true as well for all other more vulnerable groups to mental health issues facing additional precarious situation. Therefore, mental health should be an EU public health priority. This historic shift is almost underway thanks to the work of the European Parliament. As you know, we just adopted a resolution on mental health in the digital world of work. It addresses the crisis we face with the citizens' mental health in the EU. We do not have as much efficient mental health services as we need. The lack of supports and investment across the member states has resulted in pervasive mental health issues and alarming suicide rates over years, even before the pandemic. With suicide being the second higher cause of death of citizens under the age of 19. Mental health is one current European health crisis. Therefore, we called for a comprehensive EU mental health strategy with a cross-sectional approach, as indicated also in the Headway report presented today. We are also aware that the current EU-level legislation and policies in this area do not address the growing crisis of mental health amongst our workforce. It is of utmost importance that workers can expect a proper level of protection for both their physical and mental well-being. There is a need to update the current legislation on occupational safety and health legislation to respond to the new realities of the digital age. We need to ensure that collective mental health work practice are put in place to signpost our workforce. Moreover, the economic cost for member states of mental ill health cannot be ignored. Not only financing reactive care, but also the lost economic output when workers are enabled to participate in the labor force. So we believe that the principle of prevention at the workplace must be formally integrated in EU, national and companies level policies. This requires proper education and awareness initiative on mental health, training for employers, and better research and data collection at the European level. So something is moving, and we have reasons to be optimistic. It is time to take these issues seriously and examine what EU action can be taken. Ignoring this call of action will jeopardize our young generations, and I believe we are heading towards a brighter and more informed future, also thanks to you and all the people contributing to such a good cause. So thank you very much for your work.
Okay, thank you so much, Vice President Pacerno. And now I hand the floor over to your colleague, MEP, to give the closing remarks on an EU way forward. How can mental health be seen as an EU public health priority? Mr. Refrandis, please.
I'm not sure. Yeah, now, thank you. Well, it was supposed I was participate in the round table before, but I think I have the honor to do the closing remarks. In fact, my intervention try to give a global perspective of how we understand European strategy on mental health. And because, as you know, next October 10, it's the Mental Health Day. And I think that this year we are able to celebrate it with enthusiasm and consider it as a turning point in politics, since President von der Leyen announced in her State of the European Union speech a new initiative on mental health to be presented in 2023. We are therefore at a crucial moment, as Hilka has pointed out also, and when the urgency of strengthening mental health system needs to be recognized. My group, in the European Parliament, the S&D group, took a position on the urgent need for this initiative before the summer, and we published a position paper which made it very clear what our group's priorities were in this area. So today I would like to emphasize some of the most important ideas that my political group has included in this S&D position paper, and I know that are in line with most of the data provided by Headway project. It starts with an emphasis on the structural, systemic causes of poor mental health. Mental health disorders are shaped beyond inherent biological factors, largely by socioeconomic, social, environmental, and lifestyle factors. This is especially true for the most common mental disorders, which are emotional and behavioral disorders. Common mental disorders are associated with unemployment, low income, inadequate housing, and the poor standard of living, as well as inequalities and discrimination. That's why, from the European Parliament, we are calling for a European mental health strategy with a holistic, cross-cutting, multidisciplinary approach integrated into the public health system. This strategy should be structured into 4 pillars. First, education. One of the greatest challenges that today's society must face is to take care of emotional health from childhood and adolescence. More and more countries are investing in active pedagogy projects or incorporating such methods into traditional education to integrate emotional with academic competencies to promote personal, affective, and communication skills, while also attending to the mental health of teachers. In addition, the report on the impact of COVID-19 closures of educational, cultural, youth, and sports activities on children and young people in the EU, approved in the last plenary session, indicates that after the pandemic, European youth face a mental health crisis. While before the pandemic, between 10 and 20% of children and young people had mental health problems, this figure has increased to 25% in the last 2 years. This report takes stock of the situation for young people, calling for research into the long-term impact that pandemic-driven lockdowns have had on young people's mental health and cognitive development. In addition, it presents concrete proposals and recommendations to break the silence around mental health, including the designation of a European Year on Mental Health. The second pillar should be environment. Environmental initiatives are a priority for our group. From the ENVI committee, I always try to incorporate this topic in a transversal way, because today we already know to what extent a healthy environment has a positive impact on our health, as your project has shown evidence. Poorly planned urban environments with unsustainable transportation systems and a lack of green spaces increase air pollution, noise and heat, and reduce the opportunities for physical activity affecting people's physical and mental health. It's necessary to move to a life-centered perspective that is inspired by and learns from nature. In this sense, we must mention the report on the new Bauhaus that also has just been approved by the plenary. A project of an unprecedented creativity with an aim to shape a greener and fairer way of life. As human beings, we need to feel that we are in harmony with the environment, and this has to do not only with housing, but also with the city as a whole. A third pillar must take into account the impact of digitalization on different life contexts, especially in the work context. As you know, I was the shadow in the report on mental health in the digital world of work, and we asked the Commission legislation to tackle the problem of applying automatization and artificial intelligence to the work context. And finally, the fourth pillar of the strategy, health systems, that must provide good mental health care to all people and promote comprehensive models that include access to psychology and psychiatric services. In conclusion, as a socialist and also as psychologist, I believe that the structural causes of poor mental health should not be underestimated. We need a true paradigm shift in our economic model, which is why the mental health strategy must be built on the pillars of the welfare state. Thank you very much.
Okay, thank you, everyone. We are going to have to wrap up our debate. This event was, of course, organised by the European House Ambrosetti in partnership with Angelini Pharma, and you're active as media partner. If you do want to find out more information on Headway, please go to the European House Ambrosotti's website. I'm Mariam Zaidi, and thank you for joining us for this debate. Thank you so much.